for the last 5 years, I've been studying a lot of airways and ways to orthodontically help our patients provide a better airway, and met some unbelievable doctors, some guys that I think are the tops in our profession, and have become my mentors, and they all had the same common thing to tell me, and that was get out to LVI. And that's where we did it. And some of these guys have been through just about every camp there is in the dentistry world, but they all said go to LVI. So, but actually I was told to come out here about 8 years ago, and I'm just getting here. So, you know, but I wish I would have come. You know why I didn't come? Because I felt like I was so busy that I needed to work on my patients and provide for my patients and be at my practice, when I really should have been out here learning how to truly take care of them and to become more of a doctor of the mouth and not just a tooth doctor.
LVI has so many other great assets for dentists that, you know, most dentists work in their own little world, in their own little office. They might have a few colleagues that they bounce ideas off of. LVI is equipped to pretty much train you in any discipline you would like to further your education in. For instance, implants, endodontics, orthodontics, sleep apnea, and they also are very strong in practice management.
These people are some of the best practicing clinical dentists in the world. Their knowledge is amazing, and it is just a truly, I can describe it no other way, but it's an eye-opening experience. You don't know what you don't know, boy oh boy does that ring true. So, you know, if you have this thirst and hunger to become a better cosmetic dentist, I don't think you can achieve that goal without becoming a neuromuscular dentist.
You're definitely learning something new, a little bit more every time you come out here, but it's always being refreshed and changed and updated, and even things that were the standard last year, they found, hey, there's a better way to do it, a more efficient way to do it, simpler way to do it, whatever the case is, and they're constantly changing. So there's always something new going on.
LVI also has an excellent computerized online, it's called LVI Forum, and that's where your colleagues that have taken the courses and are involved with LVI can help you. For instance, you have a patient in a chair and you just want to know, you know, about periodontics or whatever it is. You can just go online quickly, do your post, and you will get an answer right away. There's always somebody responding. So you have that backbone, the support from all your instructors and from other dentists that are involved with LVI.
Since being through the training at LVI, I've brought my team with me throughout the whole continuum. And I really feel at this point that they've had the education and knowledge presented to them in such a way that they're able to really assess and recognize certain conditions related to neuromuscular conditions. It's not unusual for me to go into my studio after a hygiene visit and have my hygienist already had the patient assessed. She goes through a screening process and presents that to me. She's already spoken with the patient and sort of shown them things in their mouth and kind of let the patient self-discover their conditions as it might be related to their bite, many headache symptoms, TMD symptoms. So they're really taking on a role of helping the patient in the co-diagnosis process.
Yeah, I mean, obviously now I'm treating patients differently, the way that I do dentistry and my philosophy, but I would say as well, bringing my staff out here, I think has made a bigger impact on my practice than just what I do. I mean, my bottom line has increased considerably. The way that the staff interacts with each other, the way the staff interacts with patients, it's made a huge difference.
I think the success of the practice is built on the team, and that is why it is so important to have your team out here at LVI learning it. It's really hard, although we try to get back home and kind of reiterate and have our team meetings and go over what we learned. You have to bring it, you know, back into your office and just practice what you're taught. And once you do that, your team, I would say my hygienists sell most of my cases. But then, of course, the dentist has to be able to walk the walk also and follow up with that.
Even just having the team involved helps you because you've got the support back at home. When you get back home, you don't. When I first started coming here as an associate, I would be here on such a high and know that I was going back home to something I couldn't implement, which was, it was, you know, extremely crushing. Or, you know, you kind of got home and you were like depressed about it essentially. Now coming out here and having team members come or having Sherry come to my office, I know that the support in the office is there with all of the team members, which is huge because you're all working towards the vision together and everybody sees the vision and we all want to get there.
You might think that you can do this by yourself, but the team, your team that's around you every day is your strength, okay? The patient may see you for, 4 minutes during the exam in your hygiene schedule, but they're with your team the rest of the time, and they need to know and support your philosophy and support where you want to go. So throughout our journey, we have been bringing our team members to every course, and it has helped us grow fast and just take it to the next level and have them understand where we want to go.
If I hadn't gone to LVI, I have to say 10 years into my journey now, looking back, I would not be practicing dentistry. This has allowed me to find my niche and again to practice quality dentistry with a quality practice. That's important to me as a mom, and I love working 3 days a week and being able to focus on those things, such as TMD, sleep apnea, and cosmetics.
From core 1 on, it's just been a heck of a journey. It's been extremely educational. There's just no way we can look at dentistry the same way again. To be able to get somebody out of pain is not something that I thought I'd be able to do. Obviously, just putting them in a night guard for TMJ when they had discomfort or pain, that always kind of helped. Really didn't know what I was doing, but it always helped a little. But to get somebody who's been having migraine headaches their whole lives and been on medication, and all of a sudden being able to get them out of that pain pretty much forever, without having to take any more medications, is just invaluable. That's the other thing as far as invaluable, the cost of doing this continuing education, especially for 2 of us at once, because we've made this journey together. Yes, it's high, but actually it's priceless for what we've actually come out with. And it'll more than pay itself off in terms of cases that we're going to do right now that we're doing and in the future. And it's been extremely fun as well. We've made a lot of friends along the way. It's just a wonderful place to be, and it's really just the beginning of our journey because there's just so much more to learn, and your thirst just grows and grows to be able to come back and continue to learn and continue to take more courses.
I wouldn't be the dentist that I am without coming out here, for sure. As a new grad, I think of how much I learned in dental school, which, it's a great foundation and this, that, and the other, but just excelling to where I am today, I couldn't even fathom practicing dentistry any other way, like watching people come out of dental school and really not furthering their education, especially not to this level. And I would just, it's just, there's just, I don't know, you can't go back to the ways you were. You can't go back to being that dentist.
And I know there's a lot of you guys out there that you think that your skills are great and you might be where you want to be, but it's when you come to a great place like LVI is when you really see when you're around the people that are just awesome and they have such a wealth of knowledge that you can pick up little pearls here and there. That's when you really see how much you don't know, and that's why JUAN says that our journey is just beginning, because we know we're going to come back for more. We're at the final core 7, which is the end of the first set of continuum, but then you go on to the post-core classes, which teach us more, because there's always more to learn.
Yep.
Before my journey at LVI, it seemed like there were always dentists that I had looked up to and kind of thought, ooh, they're the guru, they're the go-to, they're the experts. And it's been interesting to see as time's gone on over the last 5 years, as I progressed through the continuum at LVI, how my thought process changed in that regards. I'm to the point now where I'm seeing myself as the go-to person, the expert in the area, somebody that other people will look up to as a mentor. And I'm really excited about that because I feel like if something can be done by somebody else, then it's probably possible for me to do it as well. So.
And I highly recommend anybody going through, the initial or thinking about coming to LVI, just do it because you will learn to become a better dentist.